About 80 million people in North America snore, and approximately 12 million Americans have sleep apnea. So what's the difference and why does it matter? Snoring is caused by the vibration of the soft palate in the uvula, occurring when the airways become obstructed during sleep. Several things can obstruct the airways and cause you to snore, including allergies and drinking before bed, being overweight, and having large tonsils or a deviated septum. If you snore now and then, you probably have nothing to worry about. But chronic snoring can be a sign of sleep apnea, a more serious sleep disorder. People with this problem stop breathing in their sleep, sometimes up to 1 minute or longer. Left untreated, sleep apnea can increase your chances of serious health conditions like high blood pressure and heart disease. At a minimum, you may feel groggy in the morning or unable to concentrate during the day. The good news is that sleep apnea is treatable. The two most common ways to treat sleep apnea are continuous positive airway pressure therapy, also known as CPAP, which is administered by a physician, or an oral appliance therapy, which is administered by a dentist. CPAP therapy can be very effective for people with sleep apnea, but some find it difficult to sleep with a mask. More people are increasingly turning to the oral appliances administered by dentists. Oral appliances are small, flexible devices that look like mouth guards. They increase the airway space and reduce air velocity and soft tissue vibration, snoring, by moving the lower jaw into a forward position. Patients who have tried both say the oral appliances are more comfortable to wear, easier to care for, and very cost-effective. If this situation is a concern to you or anyone in your family, please share it with us, and we can help. We are Susan Weinberg and Associates, DMD. We are conveniently located in Tigard, Oregon, and you can reach us by phone at 503-968-1696. Let us help you get a good night's sleep.